This is Jeremy Adams.
And this is Jessica Adams, and this is our video about the muscles.
This is the epicranius frontalis.
Action: raises the eyebrows, wrinkles the forehead. Origin: the Galea aponeurotica, and its insertion point is the skin of eyebrows and root of nose.
This is the temporalis.
Action: closes the jaw.
This is the orbicularis oculi.
Action: closes the eye tightly, not involved in blinking.
This is the masseter.
Closes the jaw. Origin: zygomatic arch of maxilla. Insertion: angle and ramus of mandible.
This is the zygomaticus major.
Raises the corners of the mouth as in smiling. Its origin is the zygomatic bone. Its insertion point is the skin and muscle at corner of mouth.
This is the buccinator.
It compresses the cheeks. Its origin is the molar region of the maxilla and mandible. Its insertion is the orbicularis oris.
This is the orbicularis oris.
It closes and protrudes or puckers lips.
This is the sternocleidomastoid.
Action: one side contracting turns the head to the opposite side. Both sides contracting flexes the head, pulls the head to the chest, and raises the sternum. Origin: mandibrium of sternum and medial portion of clavicle. Its insertion point is the mastoid process of the temporal bone and superior nuchal line of the occipital bone.
This is levator scapulae.
Elevates the scapula. Its origin is the transverse process of the C1 to C4 vertebrae, and its origin is the medial border of scapula superior to spine.
The platysma covers the sternocleidomastoid and the levator scapula.
The action is draws the angles of the mouth downward.
This is the trapezius.
Action: several movements of the scapula, rotation, elevation, and depression. Its origin is the occipital bone, ligamentum of the nuclei, spines of the C7 and all thoracic vertebrae. Its insertion is the chromion and spinous process of scapula, lateral third of clavicle.
This is the deltoid.
Abducts the humerus, flexor extends the humerus, a site for injections. Origin: lateral third of clavicle, acromion and spine of scapula. Insertion is the deltoid tuberosity of the humerus.
This is the triceps brachii.
Extends the forearm at the elbow. Origin: long head, inferior margin of glenoid cavity, lateral head, posterior humerus, medial head, distal radial groove on posterior humerus. Its insertion is the acromion, the olecranon process of ulna.
This is the brachialis.
Brachialis' action: flexes the forearm at the elbow.
Biceps brachii.
Flexes the forearm at the elbow. Short head, coracoid process. Tendon of long head runs into intertubercular sulcus and within capsule of shoulder joint. Insertion is radial tuberosity.
This is the serratus anterior.
Pulls the scapula anteriorly and downward.
Pectoralis major.
Pulls the arm forward and across the chest, adducts and medially rotates the humerus. Insertion: clavicle, sternum cartilage of ribs 1 through 6 or 7, and aponeurosis of external oblique muscles. Insertion: fibers converge to insert by short tendon into tubercular sulcus of humerus.
This is the internal intercostals.
Action: it causes forceful exhalation.
This is the external intercostals.
Action: causes forceful inhalation.
This is the pectoralis minor.
Pulls the scapula forward and downward and raises the ribs.
This is the epicranius occipitalis.
Raises the eyebrows, wrinkles the forehead. Its origin is the occipital and temporal bones, and its insertion is the Galea aponeurotica.
This is the supraspinatus.
Abducts the humerus.
This is the infraspinatus.
Laterally rotates the humerus.
This is the teres minor.
laterally rotates the humerus.
This is the teres major.
Extends, adducts, and medially rotates the humerus.
This is the rhomboideus major.
Raises and adducts the scapula.
This is the latissimus dorsi.
Extends and adducts the humerus, pulls the shoulder down and back. Origin: spinous processes of lower 6 thoracic vertebrae, lumbar vertebrae, last 3 to 4 ribs, and iliac crest. Its insertion point is the floor of the intertubercular sulcus of the humerus.
This is the subscapularis.
The subscapularis medially rotates the humerus.